Welcome to Quality Time, a Houston Methodist leading medicine podcast. I'm your host, Dr. Schaal, a clinician scientist and a retina specialist. I serve as the Chief Physician Executive of Houston Methodist, located in the world-renowned Texas Medical Center. I passionately believe that quality is the heart of healthcare. Just as a healthy heart is essential for our bodies, a commitment to quality is key for every healthcare system. Join us every month as we discuss the latest advancements in our understanding of quality in healthcare with clinicians, researchers, physicians, industry experts, and thought leaders who are as passionate as I am. Today, I'm honored to have on the podcast Dr. Eric Dickson. Dr. Dickson is President and CEO of UMass Memorial Health, the largest non-for-profit healthcare system in central Massachusetts. Dr. Dickson also serves as Professor of Emergency Medicine at the UMass Chan Medical School. And I'm also happy that he's here today because he was my commander-in-chief, my boss for 8 years when I was chair of ophthalmology and visual sciences at UMass Memorial Health, and also served as a UMass Memorial Health Medical Group president under his leadership. Welcome, Dr. Dickson.
Well, thank you, Shalomit, for a kind introduction, and it's so good to see you. And really, thank you for the opportunity. Houston Methodist has just such a fantastic reputation around the country. I had a chance to visit a few years back as part of an IHI survey that came through, and just was really amazed at the amazing things that are occurring there and in that whole complex down there. It makes what we have here in Boston look small, like a lot of things in Texas.
Everything is bigger in Texas. They say that and they mean that.
Oh, it certainly was the case when I was visiting. And so just in terms of background, I really started my career in medicine accidentally. I wanted to be a helicopter pilot when I came out of high school and joined the Army to do so. But it turns out I don't fit particularly well in a helicopter. So I had to pick another job, and they recommended that I become an Army combat medic, and I trained in Texas at Fort Sam Houston. I'm sure there's some Fort Sam Houston natives listening. And it was just wonderful. I just loved being involved with taking care of the soldiers and working with the infantry groups, and I fell in love with medicine. The Army trained me as a respiratory therapist then, and started here at UMass. It was UMass Medical Center at the time as a respiratory therapist, kind of hoping to go to med school here. Went to med school here, residency here in emergency medicine, and just have continued my career here and spent my whole career here, except for 5.5 years. I was chair of emergency medicine at the University of Iowa, and then COO of the hospital for a period of time. I came right back home and have done different leadership roles here within the healthcare system. And now it's hard to believe just over 11 years as CEO. And it's been a wonderful journey. I can't say that I like any particular part of it more than the others. I think my favorite thing has always been working with the residents and medical students, even more than being in the lab and doing research or being certainly, it's hard to derive a ton of joy out of being in an administrative role, but it's just, for me, it's like love life, no matter what you're doing at any given point in time, especially if you get to be a part of something that's so mission oriented like academic medicine.
So how did you first get introduced to the lean process improvement system?
It's a great question. I did not go looking for lean. Lean somehow found me in a moment of desperation. And so probably too early in my career, just 5 years after residency, I was an NIH-funded investigator, primarily doing basic science work, working in the emergency department, teaching in the emergency department, but really had no administrative experience. And I was offered this wonderful opportunity at the University of Iowa to be the founding chairman of the department. And I'm not quite sure what they were thinking to have somebody fresh out of residency or 5 years out of residency move into the chair role. And as I got into the role, I really struggled. I thought that being put in charge meant you were supposed to have all the answers to the problems that you were facing, and that if I could just go to, Iowa and get them to do emergency medicine the way we were doing it at UMass, everything would be fine. And of course, that failed rather quickly because nobody wants this relatively young guy from Worcester coming out and suddenly telling doctors that have been practicing medicine decades longer than me how to do their job moving forward. And it was probably seen as very disrespectful to them. But I thought that was my paradigm, my mental model for leadership. And so I was failing, deservingly so. And I went to my CEO of the hospital, wonderful, wonderful woman named Donna Caton Behensky. And I said, Donna, I'm failing. My wife works in the emergency department. She knows how bad it is. I don't know how to fix it. And she said, would you work with this guy named Sabi Singh? He just got here. We recruited him from Michigan. He's an industrial engineer. He does this thing called lean, and I think he can help you.
What year was that?
That was 2003. And Sabi is now I think he's the COO of Moffitt Cancer Center. Total non-healthcare guy that is now the CEO of a wonderful cancer center. And what Sabi taught me is that the paradigm I had in my head was completely wrong, that leadership is not about having all the answers. Leadership is about setting the goals for the people in terms of what you have to achieve, and then asking them for their ideas about what they want to try in terms of moving from where you are to where you want to be. And I will tell you, every leadership job I've had since then has been much easier because I had the right mental model in my head. And so people talk about lean and Toyota production, and I don't use those words very often anymore. I talk about engaging every one of your people every day and moving from where you are to where you aspire to be. And then using standardized, continuously improved processes to get there. And that's not threatening. That's not car manufacturing. That's just good leadership. And we applied that philosophy, and we went from being one of the worst run emergency departments in the country to one of the best, and had data to prove it, and actually got our wait time down, our door-to-doc time down to 0.
Wow.
And everything got better, and I got promoted. And, the thing that I always remember is we implemented hundreds of ideas to improve performance and fix the emergency department, and not a single one of the ideas was mine, because I didn't know anything about running the ER at Iowa, but all the people knew what was wrong and what needed to be done. And I saw you do the same exact thing when you came to the eye center here at UMass Memorial, and just transform it by listening to your people. And that's really what I think lean is all about.
Yes, I learned this thing from you. I must admit that when I became chair, I had no idea of how to improve the department. And you took us to a trip. And can you remember the trip? And how, I mean, because I think what you did there as CEO, really training your leaders to become lean leaders, has really transformed, me as a leader, and also trickled down to all the Department of Ophthalmology and other departments. So tell us a little bit about what you did as a CEO, to transform UMass to become a lean healthcare system. That's a big lift.
One of the early challenges with lean is, you can read about it, you sit in a classroom, maybe you go to Shingo training and you hear about philosophy, but you got to see it in action. And what we did is to go to ThedaCare, who was doing a really good job at the time of implementing lean under their former CEO, John Toussaint, who was still very close to. And I showed people what lean was. We huddled with the teams on the floors, and we saw how they were talking about performance, but instead of telling people what they needed to do, asking them, what do you want to try next? It's like, and for a researcher that likes to do experiments, that question, what do you want to try next, is something we were always asking in the lab, based on what we learned. And so people could see that, and you got to see it firsthand as well. And then I think one of the bigger things with ThedaCare was they had a visual management system for the healthcare system where you could see all of their performance right on the wall, their strategy, how it was going in terms of their execution. And I think one of the weakest processes at most healthcare systems and most companies in the country is their framework for execution. Strategy's fun. Strategy I find kind of easy, right? Let's get together with everyone and talk about all the great things we could do, right? And then prioritize, and that's the hard part. And I like to say, let's pick the 3 biggest things that we want to do first, and then we can move on to the other things. And then everybody's all excited, and then nothing happens, right? It's the hard part is that execution, the who, what, when. And we saw that at ThedaCare and how they use visual management to actually make sure they implemented the ideas that they came up with. And I always say, if there's one process that I could not live without of all the things we implemented with Lean, it's the execution framework. It's just this, this idea that we're going to have a meeting and talk about something, and we're going to actually do what we said we were going to do in between now and the next meeting. And just think about it for everyone out there. How many meetings have you been to where you talk about something, you decide on something, and then a month later you have the same exact meeting where nothing has happened? And I call them deja vu meetings, where didn't we just have this meeting? Didn't we make a decision? Nobody wrote anything down. Nobody did follow up. And so for us in terms of going to ThedaCare, it was like seeing it. And I went 13 times to Appleton, Wisconsin.
Wow.
Very few people, know where Appleton, Wisconsin was. It was this relatively small healthcare system that was doing it right. I brought my board members. I brought the chairs of the departments. I brought all the presidents of the entities. We'd go in a group of about 20 each time. And it was just such a jumpstart for us to get the program going. And the wonderful part is now they come to UMass Memorial to see. And you remember, you've had people do your huddles with your team, and the Jedis, as you call them, the eye center. And it was always one of the top things to see it in action. And so now, 11 years later, we're doing for other organizations what ThedaCare did for us.
So one thing is to go and see it in action in an organization that does it well. This certainly worked for me. It really changed my perspective of how to lead, gave me a toolkit. But other things that you've done at UMass Memorial is really create your own team for process improvement. Tell us a little bit about that.
So we believe that everyone has to be a problem solver. And I talk about creating an army of innovators, an army of problem solvers. And, if everybody that works for you, for us, it's 17,000 people. I think you're in 25,000 or more.
30,000.
30,000. And, so think of the power of having an army of 30,000 problem solvers. If everybody in your organization, instead of just identifying problems, saying that doesn't work, said, that doesn't work, let's put a team together and try to fix it. And so for us to do that, you had to have a group of experts that were going to do the training and help people when they came across a problem that they couldn't solve and on their own. And these are people that don't know a thing about the problems they're working on. Interestingly, they're not subject matter experts. They're problem-solving experts, but they do know how to extract information from subject matter experts, put it in a framework, come up with an experiment, what they want to try next, and measure to see if improvement occurred. And so that's my lean team. That's my transformation team. They're coaches, mentors, instructors, and for us, out of our 17,000 caregivers, over 16,000 of them have been trained in Lean, 93%. And every new employee gets trained in our problem-solving methodology. And I think especially when COVID hit, there was so many problems to solve so fast. It was all the years of investing in our people and helping them become better problem solvers over time that really paid off big for us. And we did really well during COVID compared to a lot of other organizations.
Yeah, so I was there during COVID and I saw this in action. Can you just give us an example of how Lean and the problem-solving army that you had really achieved something that was incredible in your view?
Well, I think the most amazing thing was I got a call from the governor, and he said, "Eric, there's a truck coming from FEMA, 2 trucks coming from FEMA with a field hospital. They'll be in Massachusetts within the next 24 hours. I'm hoping I can send them to Worcester, and you'll set up the field hospital." And we had 8 days to set up a field hospital with electronic health record, piped in oxygen, liquid oxygens, because that was the most important drug that we had at the time for COVID, radiology suite. And this was in a convention center, a 50,000 square foot convention center that had nothing. We had to create negative pressure system for the whole convention center. And, that's one where there's problem after problem after problem. And I remember visiting on about day 4, and they had their idea board up about, which is, everybody had been trained in it, about ideas about how, and they were huddling around their idea board and coming up with solutions to all these problems. What are we going to do about pharmacy? Are we going to bring it in? We're going to have a certain central pharmacy here. Because even though we really didn't have good drugs for COVID at the time, patients had other medications that they needed to be on. And it turned out to be one of the highest utilized field hospitals in the country. 1,000 patients were cared for in our 200 beds that we built out there. And I could not believe how little I had to get involved. That the people that I put in charge, and I picked carefully, were like master problem solvers. They had been through black belt training with us, and they knew how to map out flow and how things were going to work. And the best part of that story is, as soon as we were done with the field hospital, the CMS came out with a waiver to do hospital at home. So I grabbed the leaders that had done that, and I said, well, if you can build a field hospital, if you can build a hospital in a convention center, you could build one in people's homes. And I put them on our hospital at home program. And right now we have the 5th largest hospital at home program in the country, and just won the award last year for the best hospital home program in the country. And that's what happened with the field hospital. Dr. Broach and Pete Lancet, I put them right on the hospital at home program. And they did, in a matter of 3 months, what took Mayo Clinic, another great place, 3 years to get going. Our census in our program equaled Mayo Clinic's after 3 months.
Wow.
And they were 3 years ahead of us.
So you talked a little bit about this visual management system, the idea boards. Tell us more a little bit about what that is. I'm not sure all the listeners actually know what an idea board is, and what is the power in your mind of the idea board.
Visual management is a way to make sure everybody knows what's going on. And so I use the example with the challenges we had at the University of Iowa in the emergency department. And the big problem was door-to-doc time. It was 180 minutes in our ER. So that means you didn't see a doc for 180 minutes when you came in. And so I knew the metric we had to change was door-to-doc time. So visual management for us in that situation was right on the wall where everybody could see it, put door-to-doc time today is X in a control chart. And so everybody knew 180 minutes. And everyone agreed that was too long. And everyone agreed that people were being harmed because that was so low. So now you've clearly set the goal is we've got to move door-to-doc time down. And then you create your idea system aligned with that goal. And like a suggestion box is an idea system. It's not a good idea system. How can we get better, right? Put a note in here, you put your note in and nobody ever knows, did they implement that idea? Nobody sees the idea. Nobody has an idea, a way of adding to that idea. And, it's probably better than nothing, but it's pretty close to nothing. What we do with our idea boards is people come up with an idea about how you can move that key metric that you're trying to drive. Door-to-doc time was the example. And then there's a who, what, when. And everybody sees the who, what, when. And so as you're walking by, you see, oh, we're trying to fix door-to-doc time. And Shelley had an idea that we should do this. And one of the first ideas, and I'll use Shelley as the person that gave it for that one, was, can you move 3 chairs in front of triage so I can see the next patient? So, and then they don't have to go out in the waiting room and limp their way in and limp their way out. And if they start to deteriorate, I'll be able to pull them back quicker to the ER. Move 3 chairs. And that was almost a transformative idea. Move 3 chairs. And you know what? It's funny, no matter how much I knew about emergency medicine, I didn't know a damn thing about triage, right? But the person doing triage, they knew what to do. And that just changed everything. Okay, we implemented Shelley's idea. We moved the chairs. Look, door-to-dock time went down by 15 minutes for moving 3 chairs. What else do you got? And idea after idea after idea. And it's interesting in leadership. Everybody's looking at your results and they're telling me how fantastic I am. And I'm saying, I haven't done a thing. I just listened to people and did what they told me what to do. They're the ones that get the credit. And people will work really hard to implement their ideas. They won't work very hard to implement yours. And it's an important lesson in leadership.
I love that. And that's very, very true. That's very true. And I actually learned that from you. And I'm a believer in lean and continuous improvement. And something that you touched on that really speaks to me is that innovation in general doesn't need to be something so big and grandiose and involve a lot of technology. Innovation, it really can be a small thing that you change in your process and it makes it much, much better. How do you celebrate those innovators in your team?
Well, I talk about to our managers, and I meet with every manager every year. That's 900 people. And every new manager in person, I want to, bring them into the culture. And I say to them, really, this is what I'm asking. Get together with your team on a regular basis. Talk about performance that matters most in your area. We call that True North metrics. Ask your people for their ideas about how you can improve. Help your people implement their ideas. And by doing so, you will turn them into better problem solvers and celebrate their successes. And if there's one thing I personally forget to do, I'm just so moving on to the next thing, it's celebrating their successes. So we're famous for 100,000 in 2 ways. We've implemented over 100,000 frontline staff ideas, and we've given out 100,000 chocolate bars. And we have these very simple chocolate bar that says, thanks for taking great care of our patients and one another. But beyond that, we have a big Innovator of the Year award system, which you won twice.
4 times.
4 times. So where we get people, and this year we've had, I think, 400 submissions for ideas that were breakthrough. We have a couple different categories: ideas that were breakthrough, idea systems that were achieve the most number of ideas implemented. And so we'll go and we'll give them $1,000 worth of swag. We'll take them to our booth at the WooSox. And so we're constantly celebrating them. And that's just a big part of respect for people feeling like they're valued, right? If they feel like you value them, they won't leave you for, a 5% increase in pay, maybe for a 20% increase in pay. And that's what we're always trying to create, that environment that, we love the people that work for us. And I'm not afraid to use that word. And I often said it after COVID. What do you say about a group of people that came together and did whatever you asked of them to take care of this community during its, most difficult hours? Do you like them? No, you love them. And it's okay to love your people. It's okay to say you love your people.
So you taught us today you gave us a roadmap of how to become a lean organization. First of all, go and see other organizations that do it well. See it for yourself in your own eyes and get to ask questions from other people who are already doing it. The second thing is train your people and give them support, and process engineering is part of it. And we know that as clinicians, we really do not know how to think as engineers, but we are really smart and can learn a lot of things. So the support by process engineering is super important. And then the third thing you taught us is really this visual management systems, the idea board, and see how your own ideas come to life. And then maybe the funnest thing is don't forget to celebrate. Don't forget to celebrate successes. So this is a quality time podcast. And I want to ask you, how does this pertain to quality? I know the answer, but I want to hear it from you.
Yeah, it's a great question. And we want to be the best place to not only get care, but the best place to give care. And so the part of what we really, have worked on is trying to align the ideas about how can we improve the patient experience or the people experience. And we almost never ask for ideas about how can we be financially stronger. Because if you do it right on behalf of the patients and your people, don't worry, your finances will be fine. We had 9 years of improvements in patient satisfaction scores and quality scores, and we still have a long way to go. I'm happy with the progress, but not happy with where we are today. We're never going to be satisfied until we're truly the best place to give care.
That's wonderful. And Eric, I'm going to ask you a question that I ask all my interviewees is really, what does quality mean to you?
Yeah, I think it's most important to ask the question, what does it mean to the patients? If you ask patients, it's not patient satisfaction, it's access. Can I get an appointment? And there was just a study that came out and said that access to primary care is at the lowest it's been in America ever. And so people usually don't think about access as a quality metric. And Leapfrog doesn't look at access. The star ratings, CMS doesn't look at access. But I would say that right now, the biggest quality metric I look at is our access and are we able to get people in.
Wonderful. I love it. And I know it's true because I worked there for you for 8 years and I loved every moment. I have to say thank you, Dr. Dickson, for being a guest here at our show. You taught us a lot of things. I love the notion that we're never going to be satisfied. There's not one goal that we said, okay, we reached it and now we are the best and we're going to rest here. Thank you for listening. Quality Time is a part of Houston Methodist Leading Medicine series of physician-led podcasts. So that you never miss an episode, be sure to subscribe wherever you get your podcasts. If you enjoyed our conversation today, please consider rating this episode and sharing it with your colleagues. I appreciate your support. Thank you, and until next time, I am always listening.